Good day, everyone, and welcome to Skytale Insights. Very excited about today's episode as we're pleased to welcome Gretchen Frieling to the podcast. Among other things, Gretchen is founder and owner of G-Face MD, which has 2 medical aesthetic locations and continuing to grow, Soyier, her skincare line, and most recently Face It Live, her new conference focusing on ultrasound and anatomy. Gretchen is a triple board certified dermatopathologist with over 18 years of experience in medicine, dermatopathology, and aesthetics. Gretchen, thanks so much for being here. There were some tongue twisters there. Let's start at the beginning. What was your path into healthcare and deciding to become a doctor?
Okay, well, thank you for having me. This is so awesome to be here. Thank you for that introduction and for pronouncing my title correctly. It was perfect. My path into medicine began in my early childhood. My dad was and still is a vascular surgeon in St. Petersburg, Florida. And even in our young child years, even when I was in 3rd grade, would go on rounds with my dad in the hospital and naturally was drawn to math and science as a child, same as my sister. And fast forward into high school, really excelled in math and science, loved healthcare, loved the field, loved taking care of patients. Found myself to be a very visual learner. I loved textbooks with photos in them. I didn't like the textbooks that had all words. So little things like that really drew me to understanding the human body, understanding medicine. I loved it. At the same time, I was also a ballet dancer and danced intensively, attended the Juilliard School briefly in high school, and then had to make the decision, do I dance professionally, which I was a little short for that role. I mean, there are short ballerinas, but it wasn't in the cards for me. So I decided to go straight to medical school. I did actually backtrack my undergrad at Florida State University and then my medical school at University of Florida, and then did my residency up in the Boston area in the Harvard system and didn't leave. That's a little bit about that.
That's great. And then how did you get from there into aesthetics? What was the path into that?
So that was very interesting. So after finishing my residency, which was in pathology, so in medical school, actually in my 3rd year of rotations, was very drawn to surgery. As my dad's a surgeon, I wanted to use my hands. I wanted to cut things open and make diagnoses, but realized the life would be really challenging. So I was it was my 3rd year. I was ENT essentially, and I did some research in ENT. I loved it, but I thought the life was going to be too challenging. So I decided to pursue pathology, which at the time I thought was very nerdy, and I didn't think it was something that I would be interested in, but I was very naturally good at it. I have a photographic memory. I was very naturally good at recognizing patterns, using color as identification methods, and I always wanted to know the answer. And the phrase is cliche, but pathologists are the surgeon's physician or the surgeon's doctor because we have the answer. They wait for us. So pathology was great. I became an anatomic pathologist and a clinical pathologist. So I am able to understand and diagnose disease of all of the organs of the body. That's anatomic pathology, and clinical pathology is more of the blood banking, microbiology, clinical chemistry. So when you go get your blood drawn, analyzing those panels, and hematopathology, so diagnosis of leukemia, lymphoma, and other blood disorders. So then after that, I decided to pursue a fellowship in dermatopathology, and that's where it gets interesting because my path is interesting where I accepted a fellowship 2 years prior to actually starting that fellowship, and that was at MD Anderson Cancer Center, ironically in Texas. They chose one person in the whole United States, and there's only 49 spots for dermatopathology at all, and those are usually every 2 years. So I accepted that position knowing I would have to move to Houston. Fast forward 2 years later, I didn't want to move to Houston. I dropped out of the position actually and kind of just let fate take its course. I knew that I would end up being a dermatopathologist, but I just didn't know exactly how at that point. So I worked really hard. I tutored medical students, and I ended up at either Dartmouth or University of Vermont Medical Center. And Dartmouth at the time, the program was kind of falling apart. So I ended up in Vermont, which was great. And I loved it. They told me to chill out the minute I got there, but it was great. And that's where it got really interesting because the dermatology department there is where the Derm Path Fellowship was housed. In other institutions, pathology is where the Derm Path Fellowship lives. And they give you two unique experiences. So I had exposure to a lot of clinical dermatology. I was doing aesthetics there, not a ton, but had exposure to many things that I wouldn't have had. And I think that's where fate really plays a part. So at that point, I didn't know that I wanted to do aesthetics. I was always very entrepreneurial, but I really just was trying to get through my fellowship. So finished my fellowship, I moved back to Boston. I start a position in a dermatopathology lab, and they didn't have a position for a full-time staff member to be part of their team. It was really just, it was locums, it was per diem, and I felt discouraged. I thought, am I not good enough? Why am I not getting a full-time position like all of my friends and my colleagues? But again, it was meant to be, because not only was I able to work whenever I wanted, they had full-time work for me. I ended up working at 2 other labs, which was great. But fast forward 3 years, I was able to start my own company, and I had no pushback. So that was really beautiful. So while I was practicing dermpath at 3 places, I had 1 child at that point, and I was getting my nails done at a nail salon, and I had this idea. I was either going to start, well, the nail salon part, hold on, let me go backwards. I was either going to start a dermpath lab, which was an interesting idea because my husband's grandfather was involved in pathology labs and the formulation of dyes, as well as he made a part of the penny, which is kind of a cool little fact. But he was really interested in that idea and was really backing me and wanted to get involved in that. At the time, labs, specifically pathology labs and dermpath labs, were being purchased by dermatology companies and corporations, and it really didn't look to be promising. It wasn't something I wanted to get into, and it didn't really excite me. I needed something that was outside of the pathology space. So I thought, what about an aesthetic career and building companies in that space? And truly, when I set my mind to something, I think it just, if I feel that there's any inkling of excitement or anything about the industry that seems exciting, I want to explore it. So now back to the nail salon. I was getting my nails done, and there was a little room in the back of it. And I said, you know what, I'm just going to ask if she would ever rent that. And me being, Harvard trained and a physician, I didn't feel bad about potentially renting a 200 square foot, it wasn't even 200 square feet, 100 square foot room in the back of a nail salon. I just needed somewhere to start. And I needed to have that space under contract because I knew that would just propel me forward. So she said, I'll rent this to you for $300 a month. And there we went. The next day, I had my LLC in progress. A week later, had my company LLC. The name GFace MD was something I dreamed of because my initials are Gretchen Frieling, GF, Face MD, which is great, and we can get into how that name has evolved as well. But I just wanted to start somewhere, and I made the logo myself, knowing that all of those things can change, but I wasn't going to let them stop me from getting this company going. So I was in that space by myself with a couple people that were helping me very sporadically for a year, and then moved to a bigger space in Wellesley and have kept growing from there. We can get into all that. But yeah.
That's fantastic. A lot to unpack there. Part of a penny photographic memory. Being from Dallas, I wouldn't move to Houston either.
Yeah, no, not interested.
So now here we are. You rented 100 square feet. You now have a couple locations. I think you're looking for additional locations. You were clearly born to be in medicine. Mm-hmm. Now you're an entrepreneur, and a serious one. You have not just multiple locations, but multiple businesses. You travel, you educate. I want to get into the locations part of it. That's always what fascinates us, and I think a lot of what our clients are looking for is, how do I scale? How do I grow? You mentioned starting your own logo, and basically the concept of don't be perfect, just push forward, move forward. And we even like to say it here, breaking and rebuilding, it sounds like. And it sounds like there's even an evolution to GFace and the name. So would be interested in hearing some of that. But what are some things that, if I am trying to own my own business and I want my own medical aesthetic practice, what are maybe some top things that you skinned your knees on early on that you've since learned from?
Yeah, that's a good one. Lots of things. So so back to your first point. As I mentioned to you earlier today, every decision that you make puts you in a different direction and leads you down a certain path. And it doesn't mean you can't change that path, but understanding what your decisions mean is important, but not letting them prohibit you from moving forward. And that was always in the forefront of my mind. What was really important, what was not so important, but they're all led with intention. And one big thing, I didn't realize how fast I would grow. I knew that anything I put my mind to, I do with extreme enthusiasm. And when you build a team, you need someone with extreme enthusiasm, and that person will likely build something very great, right? I believed in myself and wouldn't take no for an answer. What's the worst thing? It fails, but I wouldn't allow that to happen. So I failed to get a good bookkeeper, and it seems simple and unimportant when you're starting, but it's extremely important because as quickly as things grew, they quickly got a little bit out of hand. And I was trying to do my own books and obviously have no clue what I'm doing there. And so that's one thing I regret. And now when I talk to young entrepreneurs that are starting out, which I love to do, I refer them to either mine or someone else because I think it's extremely important. So that was one thing. The second thing is trademarking. So when you're an entrepreneur, you want to obviously protect your business and the name, and didn't realize that it's important to trademark both the logo and the name. And again, it seems simple, but I didn't ask anyone anything. That's the other thing. The industry is very different now than when I started. I wanted to do it all myself. I put my head down. I didn't look at what anyone else was doing. I didn't compare myself to anyone else because I wanted what I was doing to be completely authentic and me. It's different now. People look to other people for advice. Maybe they take your ideas, and that's fine, but I still to this day will never do that. And I think that's put me in a place that's different than other people, and that's why. So I did everything myself. I didn't want to ask, and I didn't trademark. So I trademarked my logo in all of the colors, which is important, and then I didn't trademark my name. Fast forward 2 years, I try to trademark the name, and it's not possible, which is fine. Of course, you can exist without a trademark, and that is something that lawyers don't always tell you either because they just want you to just keep asking questions, et cetera. And now we go by the name G-Face, which G-Face is trademarked. So everything happens for a reason, and I don't say that lightly because if you believe in what you do and you're passionate about it and you work really hard, things will happen the way they're supposed to happen. If they don't happen, then you rebuild, right? But those were two things, bookkeeping and trademarking. The other thing is when I never overbuilt. So I kept my expenses tight. I stayed really small, which I think was a smart move. I didn't overbuy supplies and overbuy machines and product sitting on the shelf. You want to keep things tight. But I wish I had made my second location a little bigger initially because it didn't allow for as rapid growth. I probably would have grown quicker. However, I was able to, because I had to wait, I was able to take over the space next to me and took over the whole floor instead of having to move my location to another place. So hindsight is 20/20. Everything works out. Would I have potentially moved locations if I wasn't able to take over the floor? Yes. In that I would have been fine. But yeah, I think you have to understand what you can afford and what size of space is ideal for you to grow and how long you want to be there.
Yeah, I think you touched on important things. The trademarking I'll leave alone because that's not in our professional purview. However, I will say that we've gone through some of that as well. So as you were talking, these are things that we're living through right now also. And like you said, you trademark the logo and the name and colors and so forth. So that's always interesting. You touched on accounting essentially. And it's interesting you bring that up. To us, it's almost, I mean, obviously we're numbers people. But to me, I don't know how anyone could run a business without understanding the numbers and the financials behind it because that helps drive decisions. It helps even drive potentially culture, as interesting and weird as that sounds. But to me, it would almost be like driving a car without the controls in front of you, speedometer, fuel gauge, all of those things. Like you might still get somewhere, but it'll probably take you a little bit longer and you might run out of gas along the way once or twice. So I love that you said that. And then the other thing, that you mentioned was also fascinating, because I do think that ultimately, we hear it from people sometimes like, oh, I have 5 locations. But really the more important question and answer is, what is each location doing? Are you maximizing it? Is the demand there for it? And so it really just comes down to how healthy is the business from a financials perspective, but because that's really what allows you to grow and invest, whether it's in your team or a new location. So I love that you said that as well, is that you actually kept really tight controls of that, which probably has allowed you to get to where you are now, and you're now looking at future growth of GFace. So that's fascinating. Now, as far as you're here,
well,
right?
let me stop
Of
you for a
course.
second. So I think it's also important that I have not taken any money from anyone, and that's something that has allowed me to keep total control over my company. Not when you borrow money, it's fine, but then you have to answer to someone, or you feel like you're using their money. You are using their money, and I didn't want to do that. But there is a point where being cash strapped, for lack of a better term, is going to stop you. And there's a point where you need that extra cushion for growth. And I just think it's important to have a mentor or an advisor to help you to make those decisions. But yeah.
100%. And that comes up a lot. As you said, at some point you do run into a ceiling potentially if you're trying to scale and grow. And from there, I think you have 2 options, and you certainly touched on one. You can either borrow money from a debt perspective, so think of a bank or something like that, or borrow money from an institution or individuals and give up equity, which is an entire different conversation. And depending on where you are in your growth cycle, we like to say equity is expensive to give up. If you give up equity today and you grow into multiple more locations, you're going to look back and think, boy, that was an expensive decision. So yeah, you're absolutely right. So it's impressive that you self-funded. Congrats.
Thanks.
So now you're here. You're actually in Dallas. You're not in Boston, which means that you have all of these other businesses running without you. How do they run without you?
Well, they're not really without me, because I'm still there in spirit and constantly in contact with them. That's a very detailed and multifactorial situation, and it's still not perfect. And I'm probably not doing it the way many other people do it and run their business. But the bottom line is trust with my people. And I trust my providers. They're professionals. They're nurses or NPs or PAs that see patients. And I trust that they've had their oath with their degree, and they're going to take care of patients. Are they business people? No, but I trust that they're going to do their job and everything surrounding their job. My support extraordinaires are incredible, but have I always had those people? No. And GFace MD 1.0, 2.0, 3.0, 4.0, 5.0, 6.0, where we are now, they're very different from each other. And the people that I have now probably would not have survived me, my mental state, at GFace MD 1.0, because I was a very different person. I was very, I'm always high energy, but I was I was a control freak. I wanted to do everything. I wanted it done my way. I wanted other people's ideas, but not really, because not only was I building companies, but I was learning how to do it myself. And once I learned how to do it myself, I could then delegate it and then trust them to say, no, wait, we should do it this way, or we should do it that way. That takes time. But at the end of the day, it is your company. And if you lose everyone, you're the one who has to be able to do it. And so I'm humbled day to day when I have to do tasks like patient notes and inventory and things like that keep me humble, because I want to remember how to do them. It's getting few and far between now, but that's okay. So my team is so strong, and I don't have a business manager title. And some people would say, how do you do that? I think that title is very interesting. I don't love that title. I think it throws a lot of responsibilities on one person that could be divided to other people. And I have customer service specialists that then, instead of looking to hire another position, I look into my team and say, what are your strengths? How do you want to grow? You get into this company, you start in one position and you learn that job, but let me accelerate you. Let's start taking on other responsibilities. You're a rock star. Let's grow you and become a manager and accelerate. I love that. Does that happen with everyone? No. I have a really unique story for my quote unquote president who's coming in July. And she started as my babysitter. She was in college. No, she was in high school. I take that back. She was a senior in high school. And she walked into my house, and I knew from the minute I met her, she was brilliant. And I said, what are you doing for school? She was in business. She was also a dancer. So many similarities, lives in my town. Fast forward, she worked for me from high school and then college, doing things on the side and growing, doing social media at the beginning, and now running the back end of my company, doing payroll, even when she was studying abroad. And now she's going to come on as the president. This is interesting. Somebody asked me the other day, what is one word what's my purpose in life? And I think it's very hard for me to put everything into one word. I mean, there's so much to say, but I think my purpose is to create, and you can put that in many different buckets and just use that word in many different ways. But I like to create people and professionals and build them and see how they develop. And so I created, her of sorts, and it's been beautiful. So I trust all of them. I'm not there. Are they running my company? Yes. They all know their roles and responsibilities, but am I always in touch with them? Yes. I would say my company's never done better and never been more extraordinary as this year, and I've never traveled more, which says something. And I don't really know what it is, but I'll figure it out.
Well, I mean, I can say you said a few big things there, but one of them was building a team that you trust, and you emphasize the word trust. You're also in touch with them every day. So you are still very much in the day-to-day of the organization, but you've entrusted people to build it with you. And the other thing you mentioned that I don't know if this goes with the team aspect and the trust aspect is that you do like to build, it sounds like, and create. And along those lines, you were talking about actually creating team members. And I don't know if you meant it this way or not, but is there a lot of training there, a lot of Gretchen time to get, hey, this is what G-Face is, this is what your seat, your position requires ideally? Is there a lot of that going on?
Yeah, that's such an interesting question. So right now I'm at a transition period, but 3 years ago, and this is probably why we've had some turnover with, team members, and that's okay. That's called growth. And I was so involved with seeing my patients, and yes, there's a lot of training involved. I pride myself on the training, the education. That's what we stand behind fully. But was I able to give them 100% of my attention? No, because I was the one driving the revenue. I was the one still building the practice. I was the one still trying to hire, potentially firing. I was still doing everything in this company. It's practically impossible, but there's a point for everyone's growth that you're there. And so it happened this year where I've said, I am stepping back. I'm not going to inject as much, which is already not working out the way that I said it was going to work out, but that's okay. So I will be injecting, 1 day a week in Wellesley, 2 days a week in Mashpee Commons, and the rest of my time is spent on building these incredible injectors that I have. And I have 5 other injectors. They are rock stars, and I can't stand in the way of that anymore. They have accelerated faster than anyone I've trained, and anyone on my team is able to see my patients. And these past couple months, I've been gently telling my patients I'm stepping back. I'm not seeing patients as much, and the response has been interesting. It's varied. But at the end of the day, wouldn't you rather see a provider that I've trained and given my all to versus going somewhere else, right? And who knows what will happen? I know what will happen. It will just be incredible. And then I end that with kind of a funny thing, saying I'll probably be more around and I'll be more in your face because now I'm not seeing patients and I'll be with them and guiding them and helping them, but they won't need it because I'll have all the training because I have the time for that. So it's really amazing. It's a huge turning point.
I love that you brought that up, and you answered it, I think, to some extent. As you do scale yourself and you train team members, providers are a part of that. And that means as you travel more, as you said, you perform better, you're traveling more, so you're doing a lot of things right. And as you were talking, I did want to ask, because a lot of people, I think, struggle with this that are trying to grow their businesses. How do I go from being the doer, in this case, a provider, to actually being able to step back and work on the business? And you touched on some interesting things, because I agree with you. I think, wouldn't I rather go someplace that people are trained by Gretchen, right? And I know what I'm getting. I know the type of training I'm getting, the passion and so forth. And therefore, you're able to provide this fantastic service, not only to the number of patients that you physically could normally had you not done this, but you're able to exponentially grow that. And you said that the response varies, but it sounds like you're committed to it. How would you guide someone who did want to do exactly what you're doing? Like, look, I'm the main provider right now, but I actually want to grow. I want to become more entrepreneurial. And some people aren't going to like it. How do you stay the path? Any guidelines that you can provide here?
It's so challenging. I haven't felt this way at all until this year. And it's a combination of revenue, because if you're the only one generating revenue, you can't. So that's one thing. The second thing is the people. And I truly believe G-Face MD is about the people, and it's the way I've taken care of my people. And their talents, their natural talents, their learnability, right? Their enthusiasm, and it's timing. Because you can't force it. You can't force someone to be an amazing injector, and to decide and to determine how successful you think an injector is going to be. That takes time. So it could be a year of training, and then maybe they feel like they don't like the field anymore. Or I think truly a year is a big turning point. And we've lost members at a year multiple times, and I don't look at that as a fault. I think it's incredible. It's where we are now. It's how we got to where we are today, and I've learned something each time. But I don't think there's a secret sauce. It depends on revenue, time, and your investment in other people. And it will take losing people to learn that.
I love that. The other thing you said earlier that I want to touch on, because this is difficult for entrepreneurs. You mentioned that early on, version 1.0, maybe some of the team members you have today wouldn't have been there because you were a control freak. You wanted to do everything yourself. And I think all founders go through this. All business owners go through this, where you're thinking, well, they can't do it as well as I can. And I've heard a lot of interesting anecdotes to that. Is, like one of the examples that I heard is, if somebody can do it 80% as well as I can, that's when I learned to offload it, right? And clearly, the way to build, in our opinion, a really beautiful business is to one day, can your business live without you? And if one day you can say yes, like to us, that means, okay, you've really built something. Like you actually built a machine that's not dependent on its founder. It's now a vision-led business, not a founder-led business. But to take that first step of actually letting go is difficult. How would you suggest that any of us do this if we're going through that struggle?
Don't step on their toes. So if you have decided you are going to delegate a task, and I'm so guilty, it took me a while. If you're going to delegate a task, don't you dare go do it before they do it. I would always have in my mind, I could do it faster. They're going to write it down. It's going to take all this time, et cetera, et cetera. It could be done by now. And all I was doing was saying it. No, you have to trust them, honor them, and let them do the task. If it's done inappropriately, then you correct them and you have them redo it. You don't correct it. You let them redo the task. And that's how they learn. That's how you learn. And everyone's personality is a little bit different, but I thought that was really important because I didn't do that at the beginning. And now the way my mind works is, well, this is also interesting. So I had a one-on-one with one of my team members yesterday. We do one-on-ones each month with each of them, I do, but we also have performance reviews every 6 months, and they evaluate themselves and I evaluate them and we talk about it. And one of my team members was having a hard time remembering all the tasks because I do just spit things out and expect people to remember them. And many of them can, but she has so many things. And I said, listen, just keep a notes page up on your computer and start writing it down, and you can go back and reference it. And it seems straightforward and easy, but it was instrumental for her. But that's one thing that I still do, is I just say things out loud, but people now know how I function. They'll just write it down and say, okay, I'll do that. Does that work for everyone? I don't know. But now I even tell my patients, I'll say, Lexi or Alexia or Krista or Courtney, they're all more gentle than I am. I hurt you more than they do. So just let them do it. They're incredible. They're better than me at this point. Sometimes the youthful, newer minds have better questions to ask. They do things with more thought. Not saying I'm thoughtless, but it's beautiful to watch and it's exciting. So I would rather them do treatments than me a lot of the time. Do I love to treat patients? Yes. And now I have truly people that do things so much better than me that I don't even try. So for my skincare, my Jessica is so phenomenal and brilliant and makes these gorgeous goodie bags and gift wrapped packages for my skincare company. I didn't even ask her to do it. And she's over here creating all this magic. It's unbelievable. And that brings me to, you have to know how to make your team members feel seen, because they all feel seen in different ways. So when you see and when I see somebody do something that's completely out of the box that I didn't ask them to do, I let them know that I acknowledge and I see it and I appreciate it, because there are people in the past that have told me they didn't think that they were appreciated, and I will never forget it, because I always appreciate my team. Obviously, if you're doing a job that needs evaluation, then maybe not as much, but I appreciate so much, and I'm just now, it's at the forefront of my mind to let them know that.
I love that. Some great tips in that. And
I could just keep talking. I don't know.
No, I mean, that's great. It sounds like you're passionate about your team and that you cheer people on when they do things better than you, which I think is
it's what you want. It's the best.
That is exactly what you want. That's how you build a great firm that competes really well and does a great job for, in your case, your patients. So that's fantastic. And, it reminds me of the saying, as you were talking, of if you go into the room and you're the smartest person in the room, you're in the wrong room. So it sounds like you have some team members that do things better than you now, which I love. Now, let's get into maybe a little bit. You travel a lot, as you said. This year's been your highest travel year, and a lot of that travel, I know, are conferences, education, whether you're learning or providing the education itself. What's the passion behind that? And then maybe also why? Why do you do it?
Okay. So I love connecting with people. It's also a huge passion of mine. I love creating relationships. I was trying to get the create word in there, but it didn't work as well. We talked about the book, The Luck Factor, and I think that's a really interesting book, because I never think, number one, that I deserve anything, and number two, that I'm lucky, because I've worked my butt off to get here. And every relationship you have, every connection you make creates an opportunity to be lucky or be luckier. And I love interacting with people. I love, obviously, public speaking, and I love learning. And so the travel fuels all of those things. Is it hard on me personally? Yes. Has it been hard professionally? Yes. But I've figured out a way this year, I think, it hasn't been perfect, but to optimize professionally the business and also travel as much as I have. I don't speak at every conference I go to, because then I'm able to relax and I'm able to learn more. But also, it's fueled my own passion to create my own conference, which was 2 weeks ago now, Face It Live, which was amazing. And I know you were there. And it was the most unique conference that's out there right now. There's nothing like it. And I think in order to be unique and to be a visionary, which I am, you have to have these unreasonable expectations and unreasonable thinking. And several companies told me when I started the conference that it was too early, and it's not something that people are doing now, which is a combination of ultrasound and cadaver anatomy. But it turns out it's now going to explode, because it's right at the beginning of ultrasound and anatomy. It's amazing. So all of the conferences I go to now help give me insight into how I want to run my conference and grow it and expand it and all of that. So
That's great. And yeah, I was at that conference, as you said, and amazing job, by the way. It was such a great conference. And I remember going into it thinking, I'm not going to see Gretchen. She's going to be running around. It's conference one. She's going to make a lot of mistakes, and she's going to be needed all weekend. And what was fascinating is I saw you talking to everyone and making yourself available. So another testament to the fact that you do build a team and they perform. So congratulations on that. Looking forward to next year's. You mentioned going to conferences to learn. You do a lot of international conferences as well. And is there anything there? You said you learned something from each conference to apply to your own, whether it's life or profession. Is there anything that you've learned from going internationally that even from a macro level in the United States you think is coming, maybe if you're putting on your futuristic hat?
yes, a lot. So they have access to so many more products than we do, and most of them are used there before they come to the United States, with the exception of a couple. For example, Daxify is only in the United States, but they have access to so many products that it almost makes it more challenging to figure out what works for you. And the other thing is the standards and the degrees required for injecting are essentially null. I mean, anybody can inject in some of the countries, which is terrifying. So the complications you see are just, it's totally different. You realize what a small bubble you live in. I mean, there's a lot to learn, and everything does things very differently. I was in Seoul, Korea in September and learned a lot about threads that they do. I mean, they'll do anything. They'll try anything over there. So, and that's how we learn, is by trying new things and thinking outside of the box. So I think the United States and overseas, which is a big basket term, I mean, we work together and kind of bounce ideas off of each other, which is really incredible. I went to another conference, the CMAC conference. It's a complication management course in London, where we discussed complications from all over the world. People, decided and volunteered their complications that happened with them, which is humbling, but that's how we learn. So I think it creates a global community, which is great. And that's how my conference started. Face It started actually virtually with 8 countries, and now it's live, but it just shows you what's out there.
That's great.
Yeah.
Yeah, it sounds like a lot of what they're doing we're going to learn from and apply what we went to here, which is fantastic. And I didn't know the tidbit about the 8 other countries for Face It. So that's fascinating. Now, how about put your futuristic hat on for Gretchen? What should we expect from you maybe in the next 1 to 3 years? What are your business aspirations?
Well, stepping back from the injecting piece and working more on the business, I want to put a little bit more time into my skincare company, which we haven't talked about a ton, and that's okay. That's another side, well, it was a side business that ships nationally, and I don't have a team for that other than my G-Face team, which they're incredible, and they help me with a lot of it, but I don't have a specific Soyier team. And I look to put a lot more time and energy into that. When it comes to growth, I'm cautious about growth because I want to maintain the quality. I don't want to grow too quickly, but now I do have the growth bug where after opening a second location, now I can only think about a third location and a fourth location. And with my team expanding and having all of these different divisions, including the president and a managerial team, I envision us opening location number 3 in probably a year and a half, and then 4 soon after that. So when you develop a prototype and you have a brand, it's easy to recapitulate, rebuild, but it's really the people that matter. And so that's what I'm most hesitant about and need to spend the most time on, is building the people.
Well, it sounds like every location or business that you build, you learn something new that you even applied to, let's call it your Genesis location, right? Location 1. So, I'm guessing that'll continue, and, maybe you'll go beyond 4.
Yeah,
maybe. I think you will.
We'll see.
So thank you so much. Do you have any final points, anything that I should have asked? I had about 1,000 questions, so we may have to do another 5 podcasts. But anything that I should have asked that I didn't, or that you want the listeners to take away from this?
I think that, you have to enjoy your story and you have to enjoy what you're doing. And everybody has a different way of doing this. And that's why I love sharing my story and my background, because as a dermatopathologist, I'm very unique. I'm probably arguably the only one in the aesthetic space that has my background, and don't let that hold you back. I know there's things with dentists and not being let into conferences. Don't let that hold you back. Go for what you believe in. You have to love what you do, and don't hesitate to ask questions. People are welcome to ask me questions on my Instagram, GFaceMD, anytime. And I'm here for it.
It's great advice. Thank you again, Gretchen, for coming on. We thank you for listening and hope you got some good nuggets from today. And we'd love it if you subscribe to our podcast. Thank you, and until next time.